So this is a progressive disease, and it's caused by demyelination of the central nervous system neurons. So you'll see this most commonly in women, usually like middle-aged. It'll be diagnosed, and then it just progressively gets worse. Viral infections are going to be a higher risk for this, vitamin D deficiency, family history, and sunlight exposure. So this would be considered like an epigenetic type of disorder, meaning that it's just a lot of different things can lead to it. The actual cause of it, they don't really know. And then your common effects, I would definitely be familiar with those. You're going to have unilateral vision loss. So what is that?
One-sided vision loss.
So you're just going to have like one-sided. And then cognitive loss, that kind of happens later. Sometimes they're not able to control bladder and bowel function. Spasticity is a big one for multiple sclerosis. Sometimes you'll see paresthesias, numbness, things like that. And then nystagmus is another big thing, which is like eye movements.
Shaky.
Nystagmus. Oh, it's like eye movements, like irregular eye movements.
Nystagmus.
Yeah.
That's what elderly people have.
Hydrocephalus. What do you guys think that means if you break down the word?
Hydro water.
In the brain.
Yep. So this is usually swelling or fluid around the brain. There's an imbalance of the cerebral spinal fluid, and that leads to ventricular enlargement, which leads to increased intracranial pressure. So with these, you'll see this in childhood a lot. Not a lot, but you're going to see it in kids more than you would adults. If you see this in an adult, it's usually because of an injury. But these kids will end up with a VP shunt, which is like a ventricular something shunt. But it's that tube I was talking about where they insert it in the brain, and it's usually connected down through like the GI tract. And so they actually excrete the fluid, which helps with the swelling. There are causes, again, that are not like a birth defect. A lot of times it is a birth defect, but sometimes you can get this from like a brain tumor, an injury, meningitis. Actually, the girl that I know that passed away, she has severe hydrocephalus. And then your main clinical manifestations in babies are going to be obviously the enlarged head, and then bulging fontanelles. You guys know what a fontanelle is on a baby? So it's like the little.
So the soft spot?
Yeah, the soft spot on the baby's head, that will be bulging because everything's swelling, right? That's not normal. And then they'll have sunset eyes, which is kind of like just a glaze. Like they don't really like move their eyes like normal. They just almost seem like they're in a glaze. They'll have a very high-pitched cry, and they'll have vomiting. We definitely need to know those manifestations. Parkinson's. Gotta know all of the symptoms, like the shuffling gait, the hand tremors. They'll usually have a posture, like they'll lean forward. Mask-like face, which is just like a blank stare, no expression. Rigidity. They kind of essentially lose their ability to like stand up straight. My grandmother actually had this, and she like leaned, like, so she got so bad to where she literally couldn't sit up from like the table, and she would just like lay her head on the table. She couldn't stop. And then shuffling gait is a big one, and then mask-like face. So what kind of leads to this? It is like a genetic thing, but dopamine. They end up having like decreased levels of dopamine, and so that leads to a lot of these issues. They have what they call a Lewy body dementia, and there is no cure. So again, it's just a progressive neuromuscular cognitive. You do see dementia with this a lot.
You do see what?
Dementia.
Really?
Mm-hmm. Yep. There's actually like a specific Parkinson's type of dementia, which is that Lewy bodies, but it's a very rapid. Once they kind of, so a lot of times, like my grandmother, for instance, she was diagnosed like 8 years prior to when she passed or whatever. But her dementia started maybe the last cardinal signs, we kind of just talked about this, but you got your tremors. Again, this can kind of be generalized. Bradykinesia, so they're going to be very slow moving. That shuffling gait. They're going to have that cogwheel rigidity and postural instability. So they're going to be slow. We talked about all others. Everything basically just slows down. It's a very, very sad disease. Migraines. Who has migraines? Yeah. They can be like tolerable, but then they can also be incapacitating. These are often hard to treat. You will see neurologists doing a lot of like, they call them cocktails of different medications to try to like, figure out what helps each person because everybody is different with these. But it's that recurrent, severe, incapacitating type of headache. Typically, you're not diagnosed with a migraine unless it's like something that goes on for several hours to several days. It's typically gonna feel like your head's being wrapped. Like it's not like a normal headache where you might have like one spot that hurts. It's gonna be like everything. It feels almost like a squeezing. And you're sensitive to everything, right? You have light sensitivity, sound sensitivity, like everything. You have what they call an aura. A lot of times, not everybody has auras, but a lot of times people who have migraines, they have an aura, which is like something that happens to them before the migraine comes on that tells them that it's about to come on. And unfortunately, you really can't, like prevent it per se. You can take a medication that might make it less severe, but different people have different auras. So sometimes you might have like really early light sensitivity, but don't have the pain yet. Sometimes people say they see like stars. Some of the ones that raise your hands, do you guys have any specific aura?
I have aura. Not like that.
Not really. Yeah. Yeah. So these are no fun. Activation of the nociceptors, which is like your pain receptors in the meninges, is a lot of times what causes these. And unfortunately, they don't really know what causes them, and I think part of that is because they're so different in everybody. But they're kind of looking into seeing if like genetics plays any role in that, which I find that interesting. So you have 4 different phases. Prodrome is like the before. It's kind of like your hours or days before. Sometimes, again, not everybody has these, but sometimes you might get like irritable, right? Your mood changes. You might crave certain foods. I get neck stiffness. That's kind of my like prodrome. And then your aura is like right before it happens. So again, it's like a tingling or light sensitivity before the pain or something like that. Some people get like ringing in their ears. I've heard that too. And then obviously the headache, which can go on for hours or days and nothing relieves it. And then your post-drome, which is usually after, it's like you're very fatigued. It's almost like after a seizure, you have like that post-ictal phase where you're just kind of like blah. It's the same thing with a migraine. You're just gonna be very like fatigued, you don't want to be bothered, that kind of thing. So these can be pretty severe. And then you have your strokes. This is cerebral circulation impairment. So you do have a hemorrhagic, and then you have an ischemic. They go into more specifics here. So thrombotic is thrombosis. Blood clot, yeah. And then embolic, which is still a clot of some form, but it's not necessarily a blood clot. So that's the difference between those two. And then your hemorrhagic is obviously where you, like a vessel busted or ruptured or something. And so hemorrhagic is the most severe. There is a very strict time frame with if somebody is having a stroke within, I think it's like 4.5 hours, to be able to receive a medication if it's a hemorrhagic. So the very first thing that somebody's gonna have done if they suspect a stroke is a CT. And the CT scan is to rule out hemorrhagic. So if it's not hemorrhagic, then you don't have to worry about that time frame. If it is hemorrhagic, then you need to give them, it's like a clot buster medication kind of thing. But they go to the ICU if they get that medication. That's pretty severe. And usually with hemorrhagic strokes, the symptoms and result of that are gonna be much more severe. So this is where you'll see people become like paralyzed or lose their mobility or lose their speech or lose their cognition. That's typically gonna be more common and more severe with hemorrhagic. Ischemic, you can still see those things, but it's not typically as bad. And you guys know what ischemic So in a stroke, it would be like a certain point in the vessel or something, or artery that caused ischemia. A TIA is basically like a very short temporary stroke. So these you're not necessarily gonna see on a scan. It's like the person had symptoms for like 5 minutes and then they went away. So a lot of times this might look like somebody's arm went numb and they seem to be like kind of brain fog for a second, but then they came back out of it like 5 minutes later and they didn't have any more issues. And so this is very much like symptom diagnosed or symptom based. Because a TIA, you might see like some kind of ischemic or like some kind of change in on a CT scan, but it's typically not going to be something that you see. And so, again, if somebody reports these symptoms, but then nothing like is seen in labs or on scans or something, then they would just call it a TIA.
Does it stand for anything?
Trans ischemic attack.
Trans-ischemic?
Yeah. Yep. So I feel like TIAs are probably the most common. And they're often missed because a lot of people, their hand might go numb or something and then they're just like, oh, I just, like that's weird. But they don't really like get it checked out. So a lot of times people have like TIAs and never really get anything done. But the more TIAs a person has, the higher risk for like a bigger stroke that they have as well. And strokes can be caused by all kinds of things. Diabetes, hypertension, smoking, poor diet, basically all the things that you educate your patients not to do. And so, I kind of already talked about this, but so a lot of the clinical manifestations you'll see are paralysis of some form most of the time. It can be, just one arm weakness. It could be like a facial droop. It could be a leg weakness. It can be both sides. It can be one side. It can have speech problems. So you'll see aphasias. There's different types of aphasia. So you have receptive aphasia where you can tell that they can't really understand what you're saying, but they can talk back to you, but what they're saying doesn't really make sense, right? You can have global aphasia where they don't understand or they can't speak, like they can't do either. And then you have expressive aphasia where you can tell they understand you, but they can't speak. And so that one to me is the most sad because like people get very frustrated with that. And then a lot of times with that, like you might give them a whiteboard or something to communicate with, but then sometimes they can't write, So these can be very hard on like their personality as well. And usually if they have something like that, it's gonna be irreversible. Occasionally people's symptoms may not be completely irreversible, but you can improve them a little bit with like occupational therapy, speech therapy, and physical therapy, but typically they're not gonna get like normal baseline again. They say vomiting. I work on a stroke unit and I've never seen like vomiting from that. It's usually gonna be like your headache and your speech issues, mobility issues, things like that. This is just aging. So again, we kind of mentioned earlier, everything slows down. You have your typical physiological signs, decreased neuron, decreased myelin, which is like nerve muscle and things. Neurotransmitters kind of slow down. You'll get things like osteoporosis, reduced bone, all of the things, cognitive decline. And then we have Alzheimer's. I would understand the different stages. So they said that you couldn't really diagnose this when the person's still alive, but you can see a little bit. You can see changes like on scans. And then there's an amyloid beta deposit, which is like something in the brain that will show up. And so with those and the neurofibrillary tangles, those are things that you can see on a scan. And those are kind of like the cardinal signs of diagnosing Alzheimer's now. This is all from plaques. Typically, they're going to start in the temporal lobes, but again, kind of what I mentioned earlier, if you look at a scan, you can see the brain like atrophy when you're comparing like maybe their baseline 20 years earlier versus what they are now. And this just gets progressively worse. There is a genetic factor. If an immediate parent has Alzheimer's, you actually have a 50% chance higher of getting it yourself. So there is a big genetic factor. And then I would be more familiar with the later stages. That's usually what they'll test on. Cause the earlier stages are kind of, you know, they change among people. It's not, and you don't always see symptoms right away, or it might be something like forgetful, but they're older, so you don't really think anything of it. That happens a lot. But then when they get into the severe stages, you have like swallowing issues, cause if you think about it, your brain atrophies, so they're essentially losing function, not just cognitively, but even like motor-wise too. Just because everything's breaking down. So swallowing is a big one, speech changes, things like that. And then I'm sure you guys know that there's a lot of behavior changes with this as well. So, and that's it. How do you feel? Neuro's not too terrible. I feel like, I say that because I feel like most people are familiar with a lot of the conditions, but not me. Alright, any questions about anything in the PowerPoint? You look like you're thinking earlier.
No, I'm thinking about what's the overarching term. Is it dementia or Alzheimer's or something?
So Alzheimer's is a form of dementia.
So dementia and Alzheimer's.
But with Alzheimer's, you're gonna have those plaques, that amyloid beta
Yeah.
buildup, and then the neurofibrillary, like tangles is what they call them. So you'll see those in the brain on the scan. Whereas dementia, you're gonna